Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about a unique case of Burkitt's lymphoma. Now, we all know that Burkitt's lymphoma is a variety of the non-Hodgkin's lymphoma, though the occurrence is very uncommon in India. Now, the cardiac involvement in sporadic Burkitt's lymphoma is even more a rare occurrence. Now, in such cases, the cardiac involvement may be primary or even a part of a systemic disease process. Now, it is known to affect the endocardium, the myocardium, or even the pericardium. Now, cardiac symptoms may or may not be present in the early clinical stages. Now, let me elaborate on the case report that I'm going to talk about today. So, a 13-year-old Muslim boy of Malda, which is in West Bengal, presented with complaints of insidious onset, dull aching intermittent abdominal pain and a right-sided neck swelling for almost a period of 3 months. There was no associated history of fever, rash, anorexia, weight loss, chest pain, palpitations, shortness of breath, or even syncope. Now, there was also no history of similar illnesses or any chronic diseases in the past, and the boy had a normal developmental and a birth history. There was no history of consanguinity in the family as well. The abdominal sonography was done and it revealed a hyperechoic space that occupied lesions occupying the left flank of the retroperitoneal origin and multiple enlarged para-aortic lymph nodes. Mild ascites was also present. Another hypoechoic space it occupied the lesions was also present at level 3 of the right side of the neck with partial necrosis and also extending up to the right parotid gland. So a hypoechoic space occupied lesions was incidentally detected at the right atrial wall as well. The scrotal sonography showed bilateral testicular enlargements with multiple vascular and hypoechoic lesions with distortion of the testicular architecture. Echocardiography was done showing multiple heterogeneous space occupied lesions arising from the interarterial septum. Histopathologically, when evaluated, the tumor cells typically had round and oval nuclei and 2 to 5 distinct nucleoli. High rates of proliferation as well as apoptosis was characteristic, and macrophages containing ingested nuclear debris was surrounded by a clear space which is creating a starry sky pattern. The clinical features and investigations of this case were correlating to Burkitt's lymphoma, but the cardiac involvement as an interatrial septal mass was considered a rare occurrence. So it all comes down to additional and proper diagnosis. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.